A looming health crisis in Nakuru County following the termination of contracts for hospital workers on short contract basis who are hired for 3 months beginning April this year is in the offing. The affected workers are currently on a go-slow, alleging that they were promised that their contracts would be renewed with better terms of employment. About 800 workers are likely to be affected from 11 sub-counties in Nakuru County. Here's NTV's Ruth Sarmoy with the details.
Operations were paralyzed at the Nakuru Level 6 hospital after over 170 hospital staff took to the streets to protest the notice of the end of their 3 months contract, contrary to their expectations.
Governor Susan Kihika was appointed into office. She said that all of us as the hospital contracted staff, we are all going to be absorbed under permanent and pensionable. She gave us a 3 months contract which is now ending, and instead of permanent and pensionable, what we are receiving right now is termination of contracts.
I, Susan Kihika, do hereby swear.
During her inaugural speech in August 2022 as Nakuru's third governor, Susan Kihika promised to improve the welfare of healthcare workers.
My government will continue to focus on the health sector and will undertake the following: promotion and redesignations of healthcare workers. Healthcare workers serving on contract will be confirmed as permanent and pensionable.
The workers suspect foul play by top officials in the county government since they were notified of their end of contract about 2 weeks ago.
We were given this letter on June, but it was written on 31st May.
We had approached the county chief officer of health services and tried to air out our grievances. But the blatant answer he gave us, he told us, "Mimi siwajui, go sort out yourself."
The notice, undersigned by the Nakuru County Chief Officer for Medical Services, Dr. John Murima, is set to affect specialist doctors, nurses, clerks, as well as drivers in different government facilities within the county. NTV has obtained documents indicating that a total of 538 healthcare workers from different cadres and 244 drivers and hospital clerks are likely to be affected by the upcoming termination at the end of June.
We are 3/4 of the staffs who are working here. So who are these people who are going to be appointed to replace us? There's no advertisement, there's no interviews that are going on. All we are hearing is rumors that MCAs are telling people to bring their own people.
Our phone calls and text to Jacqueline Osoro, the Nakuru Health Executive Committee member, to get their response on the matter were unanswered.
We are frustrated, we are devastated right now. Imagine working in a facility for over 5 years in ICU, in labor ward, and then you're being sent home.
We can surely say that the healthcare staffs are mentally disturbed. The healthcare staffs in general, the state of healthcare in this country, in this Kenya of ours, is at stake. The way things are being run, this is not the kind of life that we are supposed to be living.
Ruth Sarmoy, NTV, Nakuru.